Picture this. You're responding to a call or code blue for a patient in sudden cardiac arrest. To save him, you'll need to perform CPR per AHA guidelines. Will this patient survive with manual CPR alone? It's hard to say. According to a 2013 American Heart Association study, nearly 360,000 people suffer sudden cardiac arrest outside of a hospital, with less than 10% of patients surviving. Additionally, many healthcare workers report that performing CPR is one of the most physically demanding parts of their job. With the ROSC-U miniature chest compressor, you can quickly deploy mechanical CPR, allowing you to focus on other tasks, which may increase the odds of the patient's survival. This is because the ROSC-U miniature chest compressor not only meets AHA guidelines, but offers consistent compressions with minimized interruptions and better venous return and cardiac output. ROSC-U never gets tired or fatigued, allowing you to focus on the patient's other needs. It can be used in a moving ambulance or on a hospital bed, which will reduce fatigue and back injuries to healthcare workers. In a hospital environment, since ROSC-U does not require a backboard, it can be used while a patient is on a bed, and the low profile of the compressor permits use while a patient is in a cath lab. Now, let's walk through the setup and operation of the ROSC-U miniature chest compressor. ROSC-U is intuitive and easy to use. There's no complicated programming, and it can be effectively deployed in 10 seconds, minimizing interruptions to CPR. To prepare the device for use, first place the carrying case near the patient. Then unpack the compressor, head stabilizer, and the torso restraint. Roll the torso restraint out in a continuous line, making sure the Velcro does not self-attach. Unlike a belt that will still pull tight when twisted, the torso restraint will not function properly if it is not rolled out flat. This must be done before putting it on the patient. We suggest that the battery control unit stays in the carrying case whenever possible. Next, check that the charging plug, which is accessed through a flap on the side of the bag, has been removed from the control unit. If the plug is still attached, the main rocker switch will not illuminate. Compressions can only begin once the charging plug has been removed. Now insert the charging port cover into the charging port to protect it from debris and contaminants. Make sure that the compressor and battery control unit are securely attached. Once you've gone through these steps, you're ready to position the device for use on the patient. First, carefully tilt the patient, allowing the torso restraint to pass under his or her back. Use the Resuscitation International beating heart symbol on the torso restraint to center it under the patient's back. Alternatively, one responder can straddle the patient and lift their arms, pulling them forward, while the other responder slips the torso restraint under the patient's back and uses the beating heart symbol for proper alignment. Be sure to utilize proper technique to avoid injury to yourself or the patient. While making sure that the umbilical power cord points toward the patient's feet, position the center of the compressor pad of the compressor along an imaginary line that connects the patient's nipples. This should be approximately 3 to 4 centimeters, or 1.2 to 1.6 inches, from the bottom of the sternal notch. In a pinch, you can use 1 to 2 fingers width as the measurement. Pay close attention to the proper placement of the compressor pad. Incorrect positioning will diminish the quality of compressions and may cause injury to the patient. Once the torso restraint and compressor pad are in the correct position, connect and secure the gray end rings of the torso restraint to the metal hooks on either side of the base of the compressor. As you do this, maintain the center line of the compressor pad on the patient's chest. With your responding partner, pull the torso restraint ends out and down, tightly and firmly in unison, using the Velcro to secure the fit. Finally, tuck the ends of the torso restraint under the patient for increased security. An important aspect to successful CPR using ROSC-U is the torso restraint. It must be securely tightened in order for the compressor to successfully perform compressions. Attention to the proper application and securing of the torso restraint is the key to successful deployment. Once you've properly attached and secured the device, set the main power rocker switch to on. It will illuminate. Then press the Start-Stop button on the battery control unit to begin compressions. The first few compressions will be partial strokes due to the device calibrating and are appropriate for proper function of this device. These compressions are calibrating the minimum force required for the depth chosen, adjusting to the patient's anatomy. If the rocker switch is left on but the unit is not in use, the 6 LEDs on the control unit will flash continuously in unison. It is possible to perform defibrillation while the ROSC-U miniature chest compressor is operating. Typically, the defibrillation electrode pads will have been applied before ROSC-U is positioned. Ensure the defibrillation electrodes and wires are not placed where the compressor pad will be located for chest compressions. If the compressor pad changes position and comes into contact with the defibrillation pads or wires, you should adjust the position of ROSC-U. After defibrillation, make sure that ROSC-U is still in the proper position on the patient's chest. And remember, you should always perform defibrillation according to the instructions supplied by the manufacturer of the defibrillator. Perhaps the most useful feature of ROSC-U is that it can be used while transporting a patient, which not only ensures consistency of compressions, but that compressions will not be interrupted. ROSC-U can be used on almost any patient transport device, including a gurney, multiple types of stretchers, stair chairs, backboards, and tarps. Make sure that the patient is properly strapped to the transportation device using locally approved procedures for safe transport. We recommend you use the head stabilizer, as it is a critical component of the total system. Make sure the head stabilizer is supporting the patient's head and is secured to the torso restraint with the Velcro strap. Once the patient achieves ROSC or CPR is terminated, press the Start-Stop button to end compressions. To power down the device entirely, turn the main power rocker switch to off. Then, remove the compressor from the patient's chest. Disconnect the torso restraint from the compressor by pulling up on one side of the Velcro torso restraint end. It is not necessary to remove the torso restraint after ROSC is achieved. Should the patient recode, the torso restraint could then be easily reattached. Note that the torso restraint and head stabilizer cover are single-use items, meaning they should be discarded and replaced after each use. Set ROSC-U and disposables aside and attend to your patient. Now that you know how to operate the device, you're ready to perform CPR with the ROSC-U miniature chest compressor.